Namaskar and a very warm welcome to the second edition of the Phone-In program. I'm Nidhi Kumar and you're watching India Science. It was indeed a big day for India on 16th of January as the Prime Minister Narendra Modi launched the world's biggest vaccination drive at some 3,000 vaccination centers across the country through video conferencing. 24 lakh beneficiaries have been vaccinated so far. In this special edition of the Phone-In program, you can ask your questions and we take your questions live. And please send us your queries. So today, friends, we are joined by Dr. Virander Singh, who's an eminent scientist, ETI founder, and a Rhodes Scholar. Many thanks, sir, for joining us today on this very historic occasion as India proceeds from virus to vaccine. Thank you so much for sparing your time. So there has been some good news for all of India as we got an approval for two corona vaccines, Covishield and Covaxin. With these two approvals, India is set to start vaccinating. I mean, as we did start, my first question to you, sir, is if I get vaccinated, for instance, I am, and the others are 100% sure that I'm not going to be infecting them, is there such a possibility?
The vaccines, whether these two in India or anywhere, the vaccination began in USA. UK was the first country to start vaccination. Whether it is Pfizer, Moderna, Covishield or Covaxin or Chinese vaccine or Russian vaccine. These vaccines are promising all of us our protection from severe disease or disease. None of the vaccines have claimed that post-vaccination that you have no fear of infection. So this should be very clearly understood by the viewers, that it still may be, of course there will be lesser chance of you getting infected, but infection carrying can still be possible. Whether you will be a transmitter of infection or not, we are still not sure. A lot of these questions will be answered only when large number of people have been given. So just going back to your question, if I get two shots, not one shot, two shots, complete vaccination, would I get the virus infection? The answer is possibilities are there. What you will not get is the disease or serious disease. And right now protection is from serious disease, no hospitalization and no death. And then of course there will be natural infection. So what vaccines are attempting that nobody should die. First of all, the deaths rate will be less. Second would be, even if you are infected, post-vaccination, we believe that the viral load will be much less and you would not be transmitting as much as if you are not vaccinated. But it should be very clear that it protects you from severe disease.
So most of our viewers are also asking question, most of them, that if we get a choice between Covishield and Covaxin, which is a better option, sir, and why?
So both vaccines are good vaccines. Both vaccines are now approved. Both the Covaxin is based on a time-tested technology, that is inactivated virus. We take polio vaccine, we take many other vaccines, hepatitis A vaccine. These are all on the same platform as the Covaxin is.
Right.
Covishield is based on a newer technology where chimpanzee virus has been genetically engineered to carry some material of the COVID-19. Both vaccines, to my mind, will be as effective. What we don't have is the clear data on Covaxin.
Okay.
But as we roll out Covaxin, and viewers know this already, that the approval for Covaxin is in the phase 3 trial. That is everybody. By maybe in 3, 4, 5 weeks, we'll have enough data on Covaxin also. So to answer your question directly.
Sir, I'd like to interrupt you. We are joined by a caller, Shivam from New Delhi, I think. Shivam Shukla. Please tell us your question. Namaste and welcome to India Science, Shivam.
Thank you, ma'am. Ma'am, my question is, I am 40-year-old. I am battling pancreatic cancer. I am eligible to be a part of the phase 1 vaccination drive. Could you please elaborate on who is eligible?
Phase 1 trial are essentially safety trials, and they have to be done under very controlled condition. Phase 1, phase 2 and even phase 3 are done on what we call healthy individual, which have no predisposition, no pre-exposure to the virus. So inclusion and exclusion criteria in the phase 1, phase 2 are very, very strict. So not only that you have to be in a certain, for example, we never do safety trial in children. We'll never do safety trials in infants. We'll never do safety trial in people above 60-year-old. So you have to be, normally this is 18 to 40, healthy, absolutely healthy with no issues. So that's for this, because you're looking for safety and immunogenicity. So they are very careful, because you're looking at dose also, whether it's going to affect you or not. So these people have to be hale, hearty, with no precondition. Any condition like you and I may have, we will be excluded from the phase 1 trial.
So I hope that answers your question, Shivam. Thank you for joining us. We're now joined by Rashi from Nagpur. Go ahead, Rashi, ask your question.
Good afternoon, sir. I would like to ask, are these vaccines are free for all of us? If they are, then how much are they expected to be cost?
What was the second part of your question?
How much is the cost of the vaccine, if free?
Yes.
So all vaccines, almost in every part of the world right now, have been purchased by governments. All government, everywhere. And I say that with greatest of clarity. European Union, Canada, UK, USA.
Even Pfizer and Moderna.
Joe Biden has already announced, the new president, that all Americans will get all vaccines free. Why should these vaccines be free? We are in an emergency approval. We are inside a pandemic. Everybody wants to open their economies. People have to go to schools and colleges. So it's in the interest of government that as many people as soon as they can immunize, and these people can get on with their work. So therefore, to answer your question, the cost of vaccines are being borne by government. At least in the phase that the Prime Minister announced, all vaccines will be free to the public. Costing wise, this is already announced. Both vaccines are going to cost to the government, not to you and I, to the government, roughly about 200 rupees, which is the cheapest price in the world for any vaccine.
Absolutely. Rashi, thank you so much for joining us. Namaste.
You,
and now we have a caller, Anil from Hyderabad, sir. Anil ji, namaste. Welcome to India Science. Please ask your question. Anil? I think we'll just connect in a while. हमारी आवाज सुन पा रहे हैं आप, अनिल? Can you hear us? Meanwhile, Anil is joining us. I know we saw that yesterday, Biden's health policy and what all he's announced. He's still the president-elect, but thinking about all these things like free vaccination for all Americans and for all citizens is indeed a noble idea, sir.
Yeah, I mean, as I said, all governments are rolling out vaccines free. It's in the interest of government, and because, as I said, it's an emergency. These vaccines are not fully licensed yet.
Yeah.
They have to be licensed, and licensing takes place after phase 4 trial.
Correct.
Phase 4 trial is yet to happen, in the sense you have to watch millions of people being vaccinated. For example, if tomorrow suddenly there are, God forbidding, there are number of very serious adverse effect, then I think the vaccination will be looked at.
So in a different light altogether. Meanwhile, Anil joins us once again. Anil from Hyderabad. Yes, Anil, please shoot. Ask your question.
Hi, sir. Good afternoon. My question is, where can I get a vaccine, and is the process to register for vaccination?
What is the process? I think the COVID app is asking.
So I thought this has been elaborated by the media and by a lot, but still I'll tell you. So government has given the priority, all governments by the way, each government has given a priority because if there are so many vaccines are available, then everybody would get immunized. So vaccine supply, manufacturing supply is limited. So each country has said our health workers, people who work in hospitals, nurses, people who drive ambulances, people who work as an employee in medical colleges or medical setup are the ones who will get. In India, that number is roughly 3 crores. So you can imagine, and all vaccine, these will have to be, these need to be vaccinated. I also would say to take a vaccine and not to take a vaccine is your choice, is everybody else's choice. So government or people like me and those who believe in vaccines have to get across to people like you that vaccination is in the interest of finishing the pandemic. By the time the question that you're asking, suppose you and I want to go and this vaccine tomorrow, I don't think we are in the queue. There will be a queue. So after this giving to health workers, the people who are above the age of 50 but have some comorbidity like diabetes, obesity, they are the ones who will get the vaccine. It will go until, to my mind, February, March. By the time general public begins to get vaccine, if they want vaccine, we will be well into April, May. But all vaccines are, again I say that all vaccines are being purchased, taken by government and being distributed. So you cannot go to a chemist and get a vaccine.
Absolutely. So one question is coming from a viewer from Andaman. And he wants to ask this question. His name is Robin. He sent us this question. He says, I live in a small remote area in Andaman. Would we face delays for the same as to the vaccination process?
So if you are not in the groups that I mentioned to you, that the first vaccines will go to the health workers and people who are exposed. My own suspicion, the next will be 50 and comorbidity, and people are queuing up. So the way to do is there is an app which you download, you give who you are, give your references, and this is sent in India very neatly. All of this information is centralized, and you will then receive a date and a time. I think by the time normal public, which is not forming these 2 or 3 groups, it will be quite a while before you get a vaccine. But those who have to go work in the factories, those who have to teach in school, colleges, those who have to deal with lots of people will form I think the next layer of people who will get the vaccine.
Yes. Meanwhile, we're waiting for the next question. We just hope that, everyone in Andaman gets vaccinated. So thank you so much, Robin, for your question. And meanwhile, we're now joined by another caller, Naveen from Mumbai. Namaste and welcome to India Science. Naveen, please ask your question.
Good afternoon, ma'am.
Good afternoon.
Hello. Good afternoon, ma'am. Hello.
Yes, yes. हमको आवाज आ रही है आपकी. Please अपना सवाल बोलिए.
Good afternoon. Ma'am, my question is, do we have the required logistics to vaccinate the entire Indian population, and how long would that take to achieve, ma'am?
So first of all, do we need to vaccinate every single individual in the country, our country or any other country? The immediate hasty answer would be, may not be necessary. How many people do we need to vaccinate? Because why do you vaccinate people? Protect them, but the main reason to vaccinate is to stop the transmission of the virus. That's the aim. So virus transmission can be stopped by masking, social distancing, cleaning your hand, which we are doing, and fairly successfully. But vaccine will be an extra tool. Vaccine will be a sure and extra tool. So you don't need to. So there's something called, I don't want to complicate the discussion, there's something called herd immunity. Herd immunity can be kicked off by either getting natural infection or by immunization through a vaccine. So what we are trying to do all over the world is to immunize sufficient people which is roughly turns out to be 70% of the population, 70 to 75%, although it differs from virus to virus, but 70 is a good ballpark figure. And then the virus does not have enough people to go and expand. Virus job is to just expand. Our job is to stop virus from expanding. So I would say 70. Everybody doesn't have to be vaccinated. I hope not. But if everybody needs to be vaccinated, last 2 days, with a massive drive, we've done 2.4 lakhs people. 240,000 people have been vaccinated. We should wait and see the average over a week. Today vaccination will happen. After 7 days, we'll divide by 7 and see how many we can vaccinate in 1 day. Remember, the supply has to be there, distribution has to be there, people have to be, it's going to be a marathon race. It's not going to be a sprint of 400 meter, 800 meter or even 1500 meter. So it would take a year and a half if you want to vaccinate everybody. And with the condition, the vaccine should be available.
Absolutely, sir. Meanwhile, we're joined by Apoorv from Delhi. Yes, Apoorv, namaste and welcome to India Science. Can we have your question? Hi.
Yeah, hi. Doctor, I have one small question. I mean, what should I do, like, if I develop any side effects after getting the vaccination?
So there are very clear instructions. When you go and get vaccinated, you'll be surprised how good quality information will be given to everyone who gets vaccinated. In that, you'll be told what are usual minor events that might happen. That is when you get a prick of vaccine. You may have little swelling there, you may have very little fever, you may feel a little bit tired, and that's why they'll keep you for 45 minutes under observation. If I take any other vaccine, that doesn't happen. This is a new vaccine. So after vaccination, there'll be a room and you'll be observed for 45 minutes. And you didn't report anything unusual, you go home. Go and play cricket or do whatever you're doing. However, in the first 24 hours after you go home, you suddenly feel something that was not happening to you is happening in next 24 hours or say even 48 hours. You have an app. You immediately inform on your app, and this app will then be where you got vaccinated and then centralized. They're deep connection, and trust me, these things have to be done very seriously all over the world. Otherwise, we will not know how many adverse effects are taking place. So let me just hammer this point: minor adverse effects will take place. Fortunately, I've seen in India what the government figure is. It's only 452.
Out of 240,000.
240,000. So at least
on day 3, these are the official figures.
At least two things have been clear, that we can vaccinate a large number of people, and then the vaccines are as safe as we thought they are. They are no less safe.
So thank you, Apoorv, for your question. We are now joined by Suresh from Kochi. Yes, Suresh. Can we have your question? Suresh, can we have you here on India Science? Please ask your question. Thank you for joining us, Suresh.
Sir, ma'am, my question is, how long would India need to complete the phase 1 vaccination drive? And what challenges do you expect to see during the first phase? How prepared are we?
So the phase 1 that you mentioned, you probably mean, which has been announced by the government, that in the phase 1, we will cover all health workers. Anything to do with the health. People who are more exposed to people who might have infection, and rightly so. So that number is about 3 crore. In 2 days, we've done 240,000 people. So you can do a quick arithmetic. If everything goes as we have started, and the vaccines, government has probably 1 crore vaccines now. So for 3 crore, we have to get 2 crore more vaccines. Fortunately, these vaccines are being produced in India. So there'll be not a major issue. But I think we have to simply watch. Now you can divide 3 crores by roughly 240,000, but I won't do that. I'll wait for a week and you will be able to answer your own question. Wait for a week, collate all the information government India gives you. Let's say this comes to number X. divide X by 7, that is your daily possibility, and then divide that by 3 crore, you'll get how many days it will take. It will go on till I think March. It should get into March, early March.
Stretch into early March. Thank you, Suresh, for your question. I hope it's
Thank you,
answered.
ma'am.
We're now joined by Chandni from Jaipur. Chandni, yes, can we have your question? I think we lost her. Chandni, can you please try and connect again?
Hello.
Yes. Hi.
Hi, ma'am. Ma'am, I'm prone to allergy. So I wanted to know that these vaccines would actually trigger severe allergic reactions or not.
Can you please repeat your question?
Ma'am, I'm prone to allergy.
She's prone to allergy.
Yes. So do you think these vaccines would actually trigger severe allergic reactions?
Sir.
Well, if you are prone to allergy, then I will not rush to take a vaccine because these things are yet to be figured out. We know from at least mRNA vaccine, Pfizer vaccine, that those who have allergy are being asked not or you take the vaccine, that you should be under strict observation, that if you get a negative or strong allergic effect, that, and there are very good drugs for allergy to take care of this. So your immunization, should it happen, should be done under very strict control conditions. So people with allergy should not just walk in as normal people, announce you have allergy. So the people who will vaccinate you, they will still be vaccinated. But they'll keep a watch on you, and ephedrine, whatever drug you take or suits you, I think you'll get that drug.
I hope that answers your question, Chandni.
Thank you so much. Thank you so much, ma'am.
We'll go in for the next caller now. We joined Geeta. So Geeta joins us from Meerut. Namaste Geeta and welcome to India Science. Please ask your question. Hello Geeta. Meanwhile, she's joining us, sir. Do tell us, there have been some reported reactions on Pfizer as well.
So Pfizer vaccine is the vaccine which has,
Especially in Norway, if I'm not wrong, yes.
so which has been given to largest number of people so far. Both Moderna was given approval little bit after Pfizer. So Pfizer is the front runner. In fact, our audience may not know this. There's so much pressure. There's a demand on Pfizer to produce their vaccine that they're stopping their production for a little while so that they can upgrade the way they form vaccine. So some of the countries, there's a whole lot of stories here. In fact, people started buying their vaccine or giving money to them somewhere in August, July and August, before the vaccines were proven. People suspected these vaccines will be successful. So countries, Canada, European Union, rich countries have placed orders of, even some people want to get Pfizer vaccine right now, you won't be able to because they're completely sold out. So Pfizer vaccine is based on mRNA, so is Moderna. These compounds which go inside as an mRNA are inherently inflammatory compounds. That's why dosing has to be extremely carefully given. So adverse effects in their phase 1 trial was about 2 or less than 2%. That much adverse effect we should expect. And in fact, that's where the communication, a very good quality communication as we are communicating now, must take place. That possibility of adverse effect will be there. But they will be minor. They will be resolvable. If serious effects happen, then we have to seriously look at our vaccine.
Yes,
But luckily that hasn't happened.
Yes. Sir, Geeta joins us now from Meerut. Yes, Geeta. Namaste and welcome to India Science. Please ask your question, Geeta.
Hello?
Yes.
Hello?
Yes.
Yes. Hello, can you hear me, ma'am?
Yes, Geeta.
Yes.
Okay. I am actually 55 years old and approximately, I think 3 months back, I developed Covid19. Now, my question is, do you think, should I get vaccinated since I already had it and then recovered? That is what I wanted to know.
So this is a question which is obviously a lot of people are asking, if I had COVID, should I rush to get another vaccine? First of all, the answer would be when the vaccines are available, to the age group that you belong to, then I think it's safer to have vaccine than not to have it. Of course, your chances of getting reinfection or infection by the virus again are minuscule. But we don't know as scientists, in fact, nobody knows as of now, seriously how long your immunity will last. Roughly, some data which has emerged from large studies, that immunity to natural exposure of COVID-19 lasts for about 3 to 4 months, or maybe 4 to 5 months, depending where you've looked at the data. If that is so, then let's say you are at the 3-month period or 4-month period, unless you get tested at that time, you actually do a test whether you have enough antibodies or not. And I don't think everybody is going to go and get tested. So our advice would be, if your turn comes, even if you have had exposure, your fear of getting exposure is much less, but vaccination will be a better idea.
So I hope that answers your question, Geeta. It's safer to get the vaccine. A lot of these debates have been happening, and a lot of these similar questions are being pouring in. My grandfather has diabetes. Should he take the vaccine? Or my sister has got asthma. Should we? So every kind of comorbidity conditions discussed. What would you like to say, doctor, to people with diabetes or something, as serious as asthma or something?
So then,
और यहाँ मैं एक चीज कहना चाहूंगी सर, because I think दिल की धड़कन जब वैक्सीन लेते हैं तो अपने आप ही तेज हो रही है. ये देखा गया था on the first day. It was noticed that people were very apprehensive about like taking the vaccine. So
I think it is because we are, the
something
flu,
new, fear of the unknown.
Flu vaccines are available all over the world every year, but the absorption of flu vaccine is not even 20% or 30%. So since there are vaccines, therefore people will take, doesn't really hold. Here is the problem of, this is a virus which is unknown, stopped your economy. You don't know what to do with this virus. So all governments are
not going away, mutating into I don't know how many.
That's another problem.
3,000, 4,000 mutations.
So if you're old and you can stay home and have no exposure to anybody, you can wait for vaccine to take place. But Queen Elizabeth and her husband at the age of 92 and 94 have taken the vaccine.
Correct. So we're joined by Pooja from Dehradun. I'll stop you here. We'll continue this later. Pooja, please ask your question. Thank you for joining us on India Science.
Okay. Good afternoon, sir. Good afternoon, ma'am. My question is, does phase 1 vaccination include people with mental health disorders? Because I had read somewhere that phase 1 includes frontline workers, health workers, safai karmcharis. So how people with mental disorder come in this category?
How, sorry?
Mental disorder. I mean, this is the same thing to add on to what we're saying.
Induced by the vaccine, or should the mental people mentally...
No, not induced by the vaccine. What she means is people suffering from mental disorder because of the,
Mental disability or disorder or diseases have nothing to do with your, hopefully, immune system. You get your immune system kick-started by the vaccine.
And the disorder, hopefully...
I thought you were asking a question, can vaccine induce mental disorder? No, these are safe vaccines, absolutely safe vaccines.
So we'd like to end now on this very, very pragmatic note, and like you said, sir, please carry on with that.
No, but if you're still on, if the viewers are still watching,
yes.
I think 2-3 things are very important. As we go into vaccination, and we know there are 120 vaccines which are still being developed. About 50 of them are in different phase trials. 5 of them are front runners, they are available, 2 in India, 3, 4 elsewhere. Tomorrow, even more robust vaccines may come.
Correct.
But the question which we are facing in science, as a vaccine developer, where would you do the trials now? For example, if you want to do trials in India, the transmission of virus is so low that your phase 3 trial will take forever. Number one, it's ethically not right that if a vaccine is available and you give a placebo, So the regulatory authorities, etc., will have to ask this question: where would Zydus vaccine be
Correct.
tested? Johnson Johnson would be tested in India. So I think as we grow, evolve, then we have to find out, maybe we don't do phase 3 trial with placebo. We
Yeah.
do phase 3 trial directly.
Correct.
Like Covaxin right now.
Correct.
So I think some of us have, then mutants. If tomorrow will be escape mutants, what will happen if there are escape mutants? Will these vaccine be valid or not?
I think we'll take these questions in the next
That's right.
phone in, sir. Thank you so much. And as you said, 2 more vaccines are coming in India, one by the Johnson Group and one is Cadila. And over time, the Wuhan virus may become just another seasonal respiratory virus.
possible.
That is a possibility. And on that note, I'd like to thank you, sir, for joining us today for this phone in. And I thank all the viewers for joining in live. And many thanks for watching us. Namaskar.
Namaskar. Thank you.